Good evening, and thank you so much for tuning in to MEDI Health Show. I am your host, MUMBI MAVUTI, and today we are going to be talking about wounds and ulcers. In case you're wondering what the difference is, how to take care of them, what treatment entails, and what you can do to prevent wounds, we are here with Dr. Gitonga from KNH, going to be educating us more on that. Karibu sana.
Shukran.
Yeah, so I'll give you a moment to introduce yourself to our viewers through this camera, then we'll pick on from there.
Okay, so good evening, all of us. My name is Gitonga-Knh. I work with the Kenyatta National Hospital, Othaya Annex, as a wound care nurse. I'm a general nurse practitioner, but then I also advanced and did wound care, which now made me a wound care practitioner, whereby I deal with all types of wounds, and basically the course which we do is called stoma, wound and continence care, whereby we deal with all types of wounds, all types of stomas. Maybe someone has a catheter, some has a colostomy, things like those. And also continence. Continence is the ability or disability to control elimination, that is urine and feces. So we also look at those things, but majorly what is most prominent and what has made us to be in this show today is about wounds, which affect so many of us. And I know many of our viewers, they have a wound right now, or they might have under hood. Even me, I under wood sometimes back, and they are a common thing in our day-to-day living. So yeah, that's what we're talking about today.
Yeah, and thank you so much for making time for us. So I mentioned it's wounds and ulcers. What's the difference?
Basically, there is no difference, because a wound can also be defined as an ulcer, and an ulcer can also be defined as an wound. But also on a medical basis, or what people know mostly is that the ulcers are associated with the stomach ulcers and things like to do with acidity and things like those. So from a textbook definition, a wound is a cut or a break of the wound of the skin, especially from external factors. But an ulcer is a break or of the skin or the mucous membrane, especially from things from within, not from without. So that's basically the difference. But more or less, a wound and an ulcer are the same thing, because you'll find that there are people who get, let's say, bed sores, or we call them pressure sores. They will be, and it will be called a pressure ulcer. But now when you get a cut or something, you are involved in an accident and the skin breaks, that's a wound. So more or less, there's no much difference, because also in the way you manage them, there is, whether it's an ulcer or whether it's a wound, it will depend now with how the wound comes in. But it will not, you not be looking at it, this is an ulcer, the management is this, or this is a wound, the management is this. Yeah. They cut across, and more or less it's like, and your English was and your vernacular, they both refer to the same thing, the same person. Yes.
Thank you for that. So you mentioned that wounds are quite common. Like you've had a wound, I have had a wound, or I have a scar that shows that I had one at some point. What is causing these wounds? What are some of the causes?
Basically, to start with, a wound is a cut. Yeah, we've said that. So you find that it's from an accident. Yeah, it's from, basically today in our Kenyan society today, most wounds are coming from accidents. Whether it's at home, whether it's on the road, whether it's at work, that's where you get wounds from. But also there are those others which are pathological. You find that someone has been sick, has been in bed for so long times, that they develop wounds from areas which have pressure to the skin. The skin will break due to the pressure, especially from the bony prominence. You find that these people will now, their skin will break, and they will start having a wound or an ulcer. Some other things you might have an issue, cancer for instance. It is a lot of people are suffering from cancer, and it's a really a menace. And with progress of disease, they might develop a wound somewhere. Diabetes is also another cause. You know, you will be injured from somewhere, and it will lead to this. So many of the causes are from accidents or from injury to the skin. Yeah.
And for these chronic wounds that are related to some chronic diseases like diabetes or cancer, are they going to break from the inside, or will you be injured by something that's external for you to develop that wound?
For diabetic patients, many of them you are injured from something, because by the time you're getting a wound as a diabetic patient, mostly if they are not normal accidents, because you'll be working in your farm, you'll be working in your workplace, and then you'll be injured. Others will come in when you have when you don't know. Many of those cases that present to us are them that someone says they didn't know until they were told they have a wound. Because when diabetes progresses, it complicates. You get something called a peripheral neuropathy. That's the instance whereby your extremities cannot feel. You'll be somewhere, an old man, my grandmother, our grandparents, they will be with the jiko or at the kitchen, and they'll step on some hot coal. They will not feel, because the nerves of the ends have died, so they will not know about it. So most of those diabetic cases come from external. But now for cancer patients, you'll find that they'll have a tumor, something which is growing, maybe it's on the head or wherever it is. It will go to the extent that it breaks. So that comes from the inside. Or some of them, those are cancerous. Somebody will be walking, will be doing their normal business in life, and then they get a small injury. That injury now progresses. By the time it's diagnosed, the wound is not healing. By the time you take them to expensive diagnosis, that's the time you get it is a cancerous thing, and they already have a wound. So the chronic conditions, some of them are from the inside, and some of them are from the outside, but they all come to us, and we tackle them. Yeah.
And so another case that maybe we might have heard of, it's after surgery. After surgery, the incisions, can that be classified as a wound also?
Yeah, so we call them surgical sites. For instance, someone goes for very common things, cesarean section, and they are stitched after the operation. Someone has another operation from maybe intestines or something, whatever operation that you may be going through, and then that area which has been stitched. Sometimes because of one reason or the other, there can be infection on the surgical site. So that infection now will need us to come in and give it proper care so that it doesn't progress and complicate. That's also considered a wound, and we call it surgical site infection. Yeah.
And when one is amputated, the part that remains, is that also classified as a wound?
Yeah, now that's a very good example for a surgical site, because once you have been amputated, the remaining part, let's say it's the hand which has been amputated, let's say from the wrist, they will need to cover the remaining part of the hand. So that's now a wound area, but it's a surgical site. Most times you don't see a wound developing from a surgical site, because the way it's done in theater, it's very sterile, it's very clean, and it heals spontaneously. But sometimes, because of one reason or the other, maybe the patient, when they go home, or the place they have been taken care of, an infection can occur, and now it complicates, but it develops into a wound. Yeah.
So that, I think that is it about the wounds that are quite common with us out there. And you happen to mention accidents. So even before we get to how they are managed at the hospital, when their skin breaks at first, what is the first thing they're supposed to do? What is the first aid measures they're supposed to take the moment they have a wound?
Once you have a wound, especially them that happen through accidents, you're home, you're chopping your onions, and then you get a cut. The first thing is run clean water on it if you have clean water. If not that, use something antiseptic. When we were growing up, we used to have Dettol. I know it's still in the market today. Use that, wipe with it, and then from there arrest the bleeding, because many of us are afraid of blood, and so arrest the bleeding so that it doesn't bleed so much, and then from there now, if it's so big or it needs medical attention, now that's the time you come to hospital. If it needs stitching, that's where we do the stitching. If it doesn't need stitching, now we dress the wound, and now we start following you up until the wound is well healed. So for the first aid measures, number one, ensure that the wound is clean. And clean, just use the normal tap water, the normal water that you can drink. Just use that, and then arrest the bleeding. Make sure that there is no bleeding which is continuing, because by the fact that you be arresting the bleeding from the site where you've been injured, it's also aiding in healing, because now the cells will start dividing to ensure that it's healed. It's a normal process which the body undertakes. So make the wound clean, arrest the bleeding
by tying,
putting a little bit of pressure, and then depending on the extent of the injury, then go to hospital. Yes.
Now suppose the extent is not something I can manage from home, and I come to the hospital. What does treatment entail? What steps will you take?
Okay, so first of all, when you present to hospital, we need to know what happened. We do the history taking, and then after that, we will need to see what wound it is and what it is. From your history now, it will tell me this wound, from what I have heard, it will need stitching. So I'll prepare my equipment so that I may stitch this client who has come in. If it doesn't need stitching, I'll prepare my equipment so that I may dress this wound. And then from there, I'll expose the wound, assess it, see how the extent of damage, and then undertake the necessary management. If it's stitching, I will stitch it up and then dress it later. If it doesn't need stitching, I just dress it, and then I release you home on some antibiotics and painkillers, because definitely it's an injury, you'll be in pain. Yes.
So that's awesome, but then again, those measures will be taken, but some wounds delay to heal. What are some of the reasons? What would make a wound not heal as fast as it should?
Yeah, okay. In wound care, we have stages of wound healing. We have the primary intention, the delayed primary intention, secondary intention. Primary intention is, for instance, when a patient goes to get a cut, they come, we stitch them up, and it heals. Within a week or 2 weeks, it's done. It leaves minimal scars. That's primary intention. Number two, we have delayed primary intention healing. This is the instance where, as you said, wounds from a surgical site. Somebody went for an operation, it got infected, so we want to remove the stitches, so that now we may clean up the area which has an infection, and then later stitch it up to ensure it heals fast. Then there is the secondary intention, whereby you had a cut, nothing is done, you just cleaned and dressed, no stitching, no nothing, it just heals by itself. And then the other areas now, maybe if you have a graft, those big wounds which will need to be patched up. You have had people saying that some piece of meat was cut from one area of the body and then put on the other one. You know, they were being patched up with their own meat or something. That's grafting. Basically, it's getting the skin from one area of the body to the affected area where you do. You patch it up, and then that skin starts growing from the wound area, and it gets healed. Also, you can do a flap if it's a wound, especially bed sores, or those wounds which are extensive, those are deep. You will, through the plastic surgeons, and that's a procedure which is done in theater. Also, the grafting is done in theater, whereby there's a way that some tissues, adipose tissues, and the skin is put over the wound, and then you stitch it up, and it heals by primary intention. Yeah.
You have mentioned about the bed sores. Are these coming from, are they common in people who are bedridden, if I could use that term, or how are they coming about?
Yeah, bed sores, mostly as they are being called, they are bed sores, bed pressure ulcers. They happen in people who are immobile, who are mostly in bed. And mostly what happens is that a bed sore or a pressure ulcer, a pressure wound happens when you exert pressure on one area for a long time. For instance, if I put pressure on my wrists for a long time, it will mean that that area which is getting the pressure will start having discoloration, because now circulation of blood there is impaired. So it will start now getting discoloration, and the tissues which are underneath will now start getting affected. Eventually they lead to ulceration, they lead to a wound developing, depending on how long it has been put there. So you find that people have been bedridden, people cannot turn themselves in bed. The way you leave them in one position, they are not going to change that position. For if you don't come to change, they'll stay like that for whatever time you'll be until you come to change them. So the areas they're sleeping on, if you look at when someone is lying in supine position, supine is when you're facing up, from the back of the head to the shoulders, to the hips, you know, down up to the heels. Those are areas which you can get wounds from because of the pressure, because once you lie there, nothing is moving you, If you are turning on the side, so you find that people on the hips, you know, on the shoulders here, you find that people will have wounds from there. Also, some of the precious wounds that we have are from the medical devices that we use. You've heard that people saying someone is in the hospital, they are being fed with pipes. We call them feeding tubes. You find that the feeding tubes will be up, they will be on the face, they will be tied on the face so that they may be in position. Those things can cause pressure, and you'll find that the area where they are going through, they might develop a wound. Maybe someone is on oxygen, maybe they are on life support machines, they are being tied to ensure that those things are in position. Those areas where they are being tied on, they can develop wounds from there. So basically, bed sores happen to people who are bedridden, people who cannot move straight on themselves, and people with medical devices. Because with the medical devices, they will exert pressure on the healthy tissues, hence causing a wound from there.
And so other types of wounds that we've not talked about is burn, when I get burned. How do I manage that, first of all from home and then at hospital?
Burns are very common, especially to children, they say, because children will be playing around, and you are at home, normal things, you have put, there's tea, there's something boiling on the kitchen, and that will be the time these kids will come in and get a burn. So number one, if you get a burn, put the burnt area in cold water. Why? Cold water will ensure that there is constriction of the vessels, of the blood vessels. So that means it draws blood from there, so there will be no bleeding. Also, because you've been burnt by something hot, when you put it in cold water, it neutralizes the heat, hence the burning feeling, the burning effect goes off. From there now, if the wound is too big, if the burn is too big, you need to come to hospital, that we may give you the extended, the further management, as we say. So when you come to hospital, depending on how the wound is, how the burn is, there are those that come in with blisters after the burn. When something, let's say it's something hot water pours on you, there will be blisters there. So depending on how they are, we can decide to deblister them, prick them, so that now the fluid comes out, and then we leave an open wound whereby we will apply the different ointments depending on the wound and availability. Then, but at home, number one, what you do is put the burnt area in cold water. And then from there, if you can be able to apply some ointment, Vaseline, it's very common, everyone has it in their home. Apply it there as you come to hospital. If you have something for pain, Panadol, something for babies, or even for an adult, you can take it. It will help so much in pain control as you come to hospital. Yes.
Back at home, the moment one has a wound, like you mentioned, clean it and then arrest the bleeding, maybe by tying it. That's all we know. Should all the wounds be covered or dressed, if I could say that, or are there wounds that are supposed to be left open?
No, there is no wound that should be left open, especially if it's an extensive wound. Yes, there are those small ones. You know, you get a little bruise. Maybe you're playing in the field. Those one might not need to be covered because they are also superficial. But if it's that wound which is beyond the skin, it needs to be covered. Why should we dress a wound? Number one is to keep it clean, because when the wound is not clean, it will not heal fast. Number two is to ensure that there is no bacteria or foreign bodies which are going in. And when bacteria get into the wound, they will contaminate it and then lengthen the process of healing. You find that if it's a wound which was supposed to heal within 2 weeks, it will extend to a month plus, which now it affects the person holistically, from knowing that I have a wound, cost-wise, and also they might not be able to function normally on their day-to-day lives. So please have your wound covered. Even if it's not in hospital, get a clean piece of cloth, tie it so that now it doesn't get contaminated from the environment, and also it can also, you can be injured from that area. It's sensitive area. It will not make you very comfortable if it's open.
Well, it's because there is this common notion that it's not going to be dry when you cover it, and that is going to affect the healing, but you're getting it from you. And
there's that notion that a wound, for a wound to heal, it has to be dry. But now, factors which affect the wound healing, among them is moisture. Moisture is what people try to do away with when they're saying that they won't get dry. So for a wound to heal better, it should be a bit moisturized. That enables the cells, when they are healing, be able to move freely around the wound and cross in well. Because when there is fluid, there is good hydration, the nutrients which are in, and the body, as it's trying to repair itself, it will be able to move well, freely around the wound. If it's wet, if it's a bit moist, it doesn't have to be so wet, but also it doesn't have to be so dry, because a dry wound, it's a hindrance to healing, so it shouldn't be that dry. That's why we ensure that when you cover it, also it ensures it locks in the moisture, which is good for wound healing.
Thank you so much for that. Here we learn and unlearn also, because it is a habit of treating ourselves. So we are talking about wounds, and we have talked about managing most of them, either at home and when we need to come to the hospital. But now there are chronic wounds, that are a wound that is not going to heal fast, like those of people with diabetes. So those people have to live their life back at home. They have maybe to do the duties that they do. So what is your advice for them? How should they go by their day-to-day lives while protecting the wound?
Chronic wounds are with us. That's the sad reality. Everyone, many of us are affected directly or indirectly, and life has to continue either way. So when you have a chronic wound, you should come to hospital. We give you the right dressing materials, and with the advanced technologies that we're having, you find that there are dressing materials that can go up to 5 days, even a week, depending on the wound. So if you have a chronic condition, if you have a chronic wound, like we've talked about diabetes, there are also others which are caused by the venous ulcers, arterial or blood vessels. When they don't function well, you find that people will have wounds, especially on the lower limbs. on the legs, you'll find that people have those wounds. So you should come to us, go to an hospital which is near you, get advised on the type of material that is to be used. Not every wound will be dressed with just bandage and crepe, you know, and that's it. There are other materials which now will enable you do your work better, live your life on a more normal basis. So go to hospital, let the wound be assessed, because you cannot classify all wounds as one. Someone will have a diabetic foot, a diabetic ulcer. Two people will come in with diabetic ulcers. All of them are affecting the same leg, the same area. But you'll find that the management of one client will be different from the other, because these things are personalized. Because maybe someone has not controlled their sugars well, the other one is controlled well. Maybe the other factors now, their lifestyles are different. So you should come to hospital, we make an assessment, personalized assessment, whereby I look at you and how you are presenting and what is more favorable for you depending on the condition you are in. So come to us, we put you on the right dressing materials, and you can do your work. You don't need to come to hospital every day for dressings. There are materials we can put there, which we are doing the dressings, and they can go for even a week or 5 days, and then you come back to us for 5 days. At least in those 5 days, you'll be able to go to your work, you'll be able to do your normal stuff. If you are employed, you'll be able to report to your duties. If you are running your business, you'll be able to do it normally, and life will continue as normal, and you'll get also well faster.
Thank you so much for that. You've mentioned that one diabetes patient might have management that is different from the other according to how they have controlled their sugar. Going to be talking much more about that, but first we're going to be taking a quick break here at Medicamp. Stay tuned, don't be away.
In the heart of Nairobi City, this February, a divine convergence will take place at Nyayo National Stadium. The churches of Kenya extend a heartfelt invitation to you as we welcome God's servant, Pastor Benny Hinn, renowned for signs, healing, and miracles. Join us at Nyayo National Stadium on the 24th and 25th of February 2024 from 3 p.m. daily. For more information, call at 0796 92 8052.
Namhitaji Bwana Panga.
Si anaweza kufanya hata mipango mimi nikawekwa kwenye MEDI store we, hata kama ni kwenye container.
Hii ndio itadetermine utakaa kazini ama unaenda nyumbani ukalime mboga na bibi yako.
Remember, you are a wanted criminal.
Sawa, unanitisha.
Sawa.
Niambie tufanye mambo ya mafupi sasa hivi.
Sawa.
Hivi karibuni nilikuwa na ndugu yangu Panga.
Kamwambie mimi sio mwanae Katu.
Panga ni nani kwako?
Ukishamjua?
Yule ni paka aelewane na mimi babake.
Mimi ninaona afadhali aachane na mimi kabisa.
Hapa hivi kwa babangu sikutaki, ondoka.
Sio mtoto atazaliwa Shakahona ama atazaliwa wapi? Hapa zaliwa mtoto hapa.
Naitwa siondoki. Mimi ndo maua wa mzee Chacha.
Sasa hiyo ndo nini sasa?
Ndo nini? Ndo twaenda hivi. Sofia na mume wake. Twaenda huko kwa mwanamke.
Huyu ni nani?
Hebu acheni hapa.
Wembe ni ule ule na kinyozi ni yule yule.
Kunguru hanenepi kwa chakula cha moja.
Na endapo utakuja fanya ujinga kama huu bro, kitakuja wakuta msinilaumu.
Mzee kijiji kitanilaumu hichi. Mkeo wako hana haja na wewe.
Tulia.
Mwache! Na bwana ni mwanamke, mwache!
Majirani,
Wewe usifike huyu.
Ufanyaje?
Welcome back, and thank you so much for staying tuned. We have been talking about wounds and ulcers, and right now we are discussing about how do you manage a chronic wound back at home. And Doc here mentioned about diabetic wounds and how you're supposed to manage them, and that if you manage your sugars well, your chances of healing are much better, and also managing your wound is going to be much more easier. Now we are stuck at how do we manage our sugars and how do they affect the healing of our wounds?
When someone has diabetes, it means that their sugars in their systems cannot be well controlled. Yeah, the body cannot naturally regulate the sugar levels in the body. So what do? We give them medication. They can be oral medications which they will be taking. They can be injectables. Yeah, people will say, mgonjwa wangu anajitungaga shindano ya sukari. That is basically insulin, whereby it can be soluble insulin or the mixed, which is long acting rather. So all that is done so that the sugars can be within normal levels of the body. But now you find that a person who has diabetes, who has been on medication, whichever it could be, oral or the injectable, has developed a wound. Now when someone has a wound, it means that the infection rate, the infection markers goes up, because the white blood cells are trying to fight the infection which might be coming through the wound. It will mean that the sugars will be haywire. They will start going up, they will start misbehaving. So it's a major factor when it comes to control of wounds. Control of wounds and sugars, they have to work closely together. So it's advisable that if you are a diabetic patient and you have a wound, ensure that you take your medication well. You ensure that your nutrition is good so that the sugars don't misbehave, because when the sugars are high, your wound will not heal fast. Why? Because bacteria feed on sugar. When your sugar levels in the body are high, it gives the bacteria a good environment to thrive. So you'll find that the wound will still continue. And that is why many of the patients who have diabetes and they develop a wound, it complicates. Reason? Because a wound will put you at a position where your sugars will be high. So the wound to heal will be difficult. When you combine those two, the wound will extend. By the time the patient is coming to hospital, it has extended so much that we need to do away with that part of the body. Probably it's a toe, it will go or something. But for us not to get there, once you are diabetic, especially because that's a major concern, especially in our society today, ensure that you go to hospital, have your sugars in check, do daily routine checkups of how they are, follow your medications keenly. If you're supposed to take your medications, the dosage and the timing, they should be followed keenly. And also now, your wound care, go to hospital, let them treat that wound, let them dress it for you, and advise you on how to go about it so that now it doesn't spread. And I have success stories of the patients I have worked with. They are diabetic, they came with bad wounds, and we followed them well, and they have healed. Now they have gone back to their normal life. So let not be a fear that if a person has diabetes, they will be amputated, because that's a major concern. People are afraid of having amputation. Everyone wouldn't want to lose any part of their body. So when you have a wound and you are diabetic, please ensure that your sugars are kept in control, your diet is kept in control, and you follow what your healthcare provider is telling you about dressings, because with those three things it will ensure that the wound will heal faster and you'll go back to your normal life. We also have other wounds, rather, like the venous or the arterial ulcers. Also those are stubborn wounds. And one thing we need to say is sometimes the wounds as they come, you don't need to be in a hurry per se. They might take long. And that's one place where when I'm in practice, when I'm working, when a client comes in, I like explaining to them from my assessment, what I'm seeing, what we expect to do, the materials that we are going to use, and the expected time. Because someone will come to you today, they'll say, I came here 2 weeks ago, there's no progress. But sometimes, depending on how the wound is, you'll start seeing the progress maybe in the second week. So by the time it's 1 week and a half, someone will start losing patience. Yeah, but some of these wounds are chronic, as we've said, and they take time to heal. So let our clients come in and they be patient, and with time, over time, there will be good progress. But most important, let's follow what we are being told by our healthcare providers wherever you are seeking help. Yeah.
Thank you so much for that. Now, do we have drugs that might interfere with the healing of wounds?
Drugs, unless now they are those that you buy over the counter or that you are allergic to, not really per se, but there are things that you will use that will be affecting you. But medication, generally, there are no known drugs that affect wound healing, because number one, you just don't get drugs from anywhere. When you're getting drugs, when you're getting medication, it needs to be prescribed. Unless now it's a typical painkiller, maramoja, which we buy over the counter. But all these other drugs, and you need to have prescription for them, so that now the doctor will be with you, will assess you and look at this medication depending on what you are having, and see their interaction. Does it affect? That's why we say, if you have, maybe you have been on some medication, you have been injured, you'll come to hospital and we'll ask you, is there medication that you're taking? So that now, that will inform me from the aspect of, this patient is on drug ABC, and they have this condition. Any other medication that I'm putting them on, will it collide, will it react, will it affect it? So I'll be able to give them the best management that we can. So basically drugs, there are no drugs that affect wound healing, yeah. Because if they are, I'll not give them to you, yeah, unless now you buy them over the counter, which is not very much advisable, yeah.
Which is highly discouraged.
Yeah.
So there are people who are treating such wounds, but then they smoke. Is there a correlation between smoking and delayed healing of wounds?
Yeah, there is a very major correlation between smoking and wound healing. You find that people who smoke, they tend to take longer before they heal, because smoking, tobacco has nicotine, yeah? And nicotine hinders wound healing. It affects cell growth. So you find that someone who is a smoker, when they have a wound, it will take longer for them to heal than someone who doesn't smoke. So it's advisable that number one, we stop smoking. Smoking kills. You know, so it's not good. And especially if you have a wound, please tone down, or if possible, stop. I know it's a process to quit smoking, but it's easier when you start it than when you say it's a long process and you don't start altogether. So it's discouraged to smoke, especially when you have a wound, because it will definitely affect how fast and how good your results will be. Yes.
And how is that so? Because someone will just know that smoking is bad, it kills, it's going to affect you, but if they don't know how, sometimes they might not take the caution. How exactly is it delaying the healing of a wound?
You see, nicotine, which is contained in tobacco, yeah, when it goes into the body, it affects how cells divide, yeah. So for a wound to heal, because there's a cut, there's a break in the consistency of your tissues. These tissues need to divide, the cells need to divide, so that now they may cover up the area which is affected. So when you smoke, the nicotine now which is in your system will not allow, will delay the process of cell division and mutation, things like those, such that the time it was supposed to take for the wound to heal, it will be lengthened. So you find that if you are a heavy smoker, let's say you use a packet of cigarettes, that's 20 sticks per day, and someone who uses 2 sticks per day, the one who uses 2 will take shorter time than who uses 20, but also the one who uses 2 will take a longer time than someone who doesn't use altogether. Yeah, because the nicotine now, which is what is contained in tobacco, is part of the reason, is what it does when healing of the wounds. Yeah.
And does the foods that we take in nutrition, does our nutrition affect how fast our wounds are going to heal?
Definitely, because for you to heal, you need to have good health, and good health is got from food. So you find that you need different things. Proteins. When we were in primary school, you were told the proteins are bodybuilding foods. Yeah. So you find that if your diet is less on protein, if you have low protein levels in your body, it will mean that your body does not have the building materials for you to heal, for the wounds to heal. So you need to have good nutrition, especially if you have a wound. High protein diet, it will be necessary, and also high vitamin. If you have high vitamin in your meals, it will also boost your immunity, so there will be less infection, and also the healing will be faster. So nutrition is a key factor. That's why when someone comes to us with a wound, you'll also need to assess their nutritional status, their nutritional situation, so that now if they have deficiencies, you need to correct those, so that now the wound can heal fast enough. So if you have a wound and your nutrition is bad, the outcome will not be as desired. So nutrition is a major factor in wound care and wound healing.
And you mentioned to us that when you have high sugars and you have a wound, it's going to tamper. Does this mean that when someone is treating a wound, they should lower their intake of carbohydrates?
No, because what do carbohydrates do? Carbohydrates give us the sugar. They are energy giving foods. So if you go down on carbohydrate, it means that you not have enough energy to work, to do your normal things. What we say is it should be balanced. When we say balanced diet, is that you are given enough, or which is essential for you to be alive, to do your normal things. It doesn't mean that because if you take high carbohydrate diet, high calorie diet, you will not heal fast. If you don't have diabetes, you don't have to worry about high sugars, because your body can be able to control them. When you talk to a nutritionist, they'll talk to you about the carbohydrate intake and the daily any calorie allocation for every person, depending. That's a whole different thing. But if you are not diabetic, you shouldn't be worried so much about the sugars issues, because carbohydrates will give you sugars, yes, but also you need this energy for you to do your normal life, for you to live. So if you're not, it's not a concern to you from a medical perspective, don't be worried. Yeah.
Thank you so much for the clarity. So now, can we prevent some of these wounds?
Wounds, yes, they can be prevented very much, especially now these that come with a condition. But now these others for accidents, even the Kiswahili say ajali haina kinga. So you might not be able to prevent those. But now these others which come with conditions, like people with hypertension, people with renal disease, people with diabetes, people with cancer, we can try and prevent those. But now that is now depending, when you work together with your doctor who is treating you, it will ensure that you don't complicate, because many of the wounds which come in, they come in as a result of complications from the conditions that you have. So if you can be able to manage your diabetes well, you can be able to manage your pressure as well, if you can be able to manage your any other condition that you have, it will mean that you might not be able to complicate and get a wound, and get an ulcer somewhere. So depending on how we see your wound when you come in to us, it will now advise us, and we'll now be able to discuss with you on what material we are going to use and how often we are going to dress or change this dressing. There are some wounds which come to us and they are really dirty. Yeah, these wounds now will need to go maybe for what we call surgical toileting. Surgical toileting is taking you to theater. We clean it up, we cut off the dead tissues and things, or basically what we call debridement. Yeah, when we remove the necrotic tissue. Necrotic tissue is any tissue which is dead. Yeah. So that now we may get to the live tissue, which we call the granulating tissue. And now here we have different materials that we use. There are ointments that we can put on the wound if it's not that very bad dirty, and it can eat away the dead tissue. So it's good that you be advised on the best materials that you're going to use, because a good material will ensure that your wound heals faster and you get better results in your desired time. So it's good that you get good and proper advice on what material should be used. There are others which can take for longer time, as I said earlier. These materials will have more benefit than those that change every day, because we say we don't need to change the dressing every day. You can do it maybe at least every other day, alternate days. If you do it today is on a Monday, you skip Tuesday and then you change it on Wednesday. That gives the wound time to grow. What we call granulate. Granulate is growth of the live tissue. Yeah, it will give it time. But when you change it on a daily basis, you find that the granulating tissues will be damaged. Such hence it will take a longer time. So it's good. Also, in these days that we are in today, technology has developed that we can use vacuum dressings. They are helping us, and they are very good, because if you have a very dirty wound which has a lot of pus, or it's a lot of it's really dirty, you can put it under vacuum. Vacuum now will suck out the excess fluids and anything that is dirtifying the wound, and it will ensure that the granulating tissue, the healthy tissue, is pulled, because vacuum, you know, it pulls. You know, if you've worked with a vacuum, it pulls things. Yeah. So it will pull in, and it's we use different devices. We have the specific devices for the vacuum, which are set on different pressures depending on the wound and the extent and the location, and it helps the wound heal fast. You know, it makes the granulation come up really nicely. You find that a wound which was very dirty, you do a session goes for like 3 to 5 days or even 7 depending. You'll do that, and within 2 weeks there's good granulation. You put some nice material there, and within a very short time, depending now with other factors, the condition of the patient, their nutritional status, you find that it will heal faster. Also, another very interesting thing is whereby we use maggot for very dirty wounds, especially diabetic patients. Maggots. Maggots are live larvae of where you put on the wound, they eat away the dead tissues, and they come up very nicely. The good part about that is because the patient might not be very stable to go to theater for a very dirty wound, because of their condition. Maybe they don't have enough blood, which anemia. Maybe their condition cannot allow them and withstand anesthesia in theater. If you put it there, though it's not really very, people have not taken it up very much. Within 2 days, it's done. This patient has not gone to theater. This patient is there just at their bedside. It can be done from home. Put it at home within 2 days. You get them off, and you'll have achieved much more. Because also, it goes to places where with your bare hands you cannot. Because those maggots will go even into those pockets in those wounds, and you'll get very nice results. So it's advisable if you have a chronic wound, if you have that wound which is disturbing, just go to hospital, let them give you the modalities which are there, and you'll be assisted. And wound care, you'll be treated very fast, and you'll be happy.
You are right, that is quite interesting, the maggot bit. But if it's helping, then I think people should take it up. So our producer, is Brian, is asking, every time he's heard someone is hurt, they say they're going for tetanus. What is its importance in treating wounds?
Tetanus, it's a bacteria, Clostridium tetani. So people come when they are injured, they come for tetanus injection. And some people, I've heard them say, I didn't go for dressings because I was given tetanus, so I'm okay. But how tetanus works is that if your tetanus is living, especially it's found mostly in soil, or in feces of animals, or in the intestines of animals. So you find that if you've been injured, chances are you might get infected with tetanus. And it's a very serious medical condition because it locks your muscles. It gives you spasms. Spasms are those things, you know, like muscle pulls. And it can affect your whole body. It's a medical emergency, as a matter of fact. But it can be easily prevented by getting the jab. Yeah. So that's the importance of how that's the relationship between tetanus and wounds, such that when someone has been injured, probably you're working in the farm, you're touching soil, or you're doing your normal things. Chances are, because tetanus normally lives in soil and in our environment, it might affect you. So that's why you go for the injection, for the tetanus jab, so that it prevents you from the wounds. From the tetanus jab will prevent you from getting infected with the tetanus bacteria. But does not mean that now with the tetanus your wound is okay. Yeah. So you should combine tetanus vaccine, because vaccines are not medication. Vaccines are to prevent. It will give you it will prevent you from getting infected with tetanus, but now you need to combine it with antibiotics and other cares now, like the wound dressings. Yeah.
Thank you so much. I think today we are quite enlightened, and that's where we want to wrap it up, unless there is something you want to hammer on.
Basically what I need to say is, if you have a wound at home, and some of us, some of our people, our relatives, us ourselves, we have really bad wounds which maybe they are smelling and anything, just go to hospital, seek help, and I know you'll find people who are willing to help you, and they'll assist you. And yeah, you'll go back to your life a normal way, and we will take care of you, and we will ensure that you have gone back to your life on a normal basis, and you'll be able to enjoy your life and live your life freely. So don't be afraid, come to hospital, let us look at it, and then we will also give you personalized care. We will look at you, what is it that you need, how can you get it, are you able to get it. We will look at it and we will give you care as per your specifications. Yeah, it's not me to say as the provider, it's not you to say. I'll just give you what is required, and you tell me what you are able to get, and then we will discuss around those and get to the best of it. So don't be afraid, and you'll be very much healed in a very short time, God willing.
Thank you so much. This has been quite an educative session. And yes, if you have a wound, don't sit back at home with it when you can get such quick help, and you can heal it in such a short span of time. So thank you so much for tuning in. Thank you so much for learning with us. And as always, remember that your health is your wealth. I have been your host, MAVUTI. See you in another episode.
Thank you.